My name's Jenny King and I'm the Chemotherapy Specialist Nurse at Brighton and Sussex University Trust Hospital. Chemotherapy is drug treatment for cancer and it can be given in a number of ways, intravenously, so injected into a vein, or in tablet form. Chemotherapy works by interfering with cell division, so it gets into your bloodstream and attacks the cancer cells wherever they are and stops them from dividing and multiplying. The first stage is that patients will have a meeting with their oncologist to decide what type of chemotherapy they're going to have. And they can have treatments in different places. It will usually be in a hospital. Most chemotherapy is given as an outpatient, in an outpatient unit. Before you actually start your chemotherapy treatment, someone will explain to you about what's involved, how long the treatments are going to take, and any possible side effects, and that will usually be done by a chemotherapy nurse before you start your treatment. When you come into the chemotherapy unit, the first thing you'll see is a room with comfortable reclining chairs. Everyone will be in their own clothes. You'll be able to sort of relax and eat and drink while you're having treatment. Your chemotherapy treatment could take a few minutes, or it could actually take several hours. During that time, you will be able to sort of walk around within the chemotherapy unit and eat and drink and read books and relax, or use a computer at the same time.
I'm just having the once a week chemotherapy 1 hour drip cisplatin, which is for a cycle of 6 weeks. It's very comfortable, as you can see. The nurses and the staff are wonderful. Everybody makes sure you're okay. Everybody lets you know what's what. Everybody makes sure that you're not in any pain and you're comfortable, and they're just there for you all the time.
Sometimes your treatment will involve having lots of different cannulas or injections, so a Picc Line is used to replace that, to avoid you having another needle each time you come for treatment. Or it might be that your treatment involves having a small chemotherapy pump attached. This will be attached to the end of your Picc Line for a few days or even up to a week, and you'll go home with the pump attached and come back to the hospital to have it removed once it's infused. The chemotherapy pump is a small device. It's this big and it fits on the end of your Picc Line, and it's automatically set to slowly infuse the chemotherapy drug into your bloodstream. You won't need to do anything about it at home. It will automatically deliver the drug into your body, and your chemotherapy nurse will explain to you about any care that you need to take of it at home. It's natural to feel scared about some of the possible side effects of chemotherapy, but everybody reacts differently and it's unlikely you're going to experience all of the side effects. The most common ones are feeling very tired after treatment, or also feeling sick, but there's plenty of things that we can do to help you with that, so it's important to let us know if you're experiencing any side effects. Some of the other common side effects of chemotherapy are an increased risk of infection, so it's really important to let your doctor or nurse know straight away if you think you're coming down with any signs of infection, such as a fever, high temperature, feeling unwell.
I had some mild side effects on Saturday because I have to come up to the hospital Monday to Friday. I think I'm focused, and because I live on my own, sometimes it can be a bit frightening, and I think because I had the time on Saturday to reflect, I got a bit frightened and a bit depressed, but the nurses were on hand for me to call them and assure me that everything is quite normal, and I was much better again on Sunday.
There's lots of information on the Macmillan website about all types of intravenous chemotherapy, or if you have any concerns, you can call the Macmillan support line.
Today I'm feeling well and good again and ready for this week's sessions.